Hello and welcome back to the concluding episode of the two-day Mega Global Digital Health Summit Expo and Innovation Awards. The second day of the summit delved deeper into critical areas of digital health transformation. First up, Summit Co-Chair Anne Mond Johnson, CEO, American Telemedicine Association, and Dr. Rajendra Pratap Gupta, Chairman, Global Digital Health Summit, set the tone for the Day 2 of Global Digital Health Summit 2024 and discussed the important role of digital technology in healthcare.
So, Anne, you saw the entire day, you kicked off the proceedings. What did you take home?
So I was very reassured that in my opening comments, I said that more unites us than divides us. And that could not have been further emphasized or validated in all the conversations yesterday that I joined. It was really the issue of, starting from virtual nursing and how we support nurses and give them joy back to their work. It was all the innovation that goes on in terms of robotic surgery as well as many other things, AI and so forth, reaching communities that have been difficult to reach in the past and how we're going to use technology. So that's one thing I learned. What about you?
Excellent. So, my first thing is one of the biggest profound messages that you gave at this forum is digitalize through people, not to people.
Yeah.
If you got that message from Anne right, you have got your pathway for the next year and probably for your profession, for your organization. The second thing is that digital health is a force. Don't fear it. And third thing, it is not infinite time with us to implement. Have a finite time to implement. India will outpace the US and Europe. It's not a question of whether, it's a question of when. And I think these kind of forums help prepare that to happen faster.
The summit also witnessed the launch of the Patient Centricity Index, a tool designed to transform how patient centricity is assessed, how healthcare is marketed, and how the quality of care is evaluated.
I had the chance to be on the National Accreditation Board for Hospitals and Healthcare for many years. I have never put that in public domain because it's a sensitive role and you get requests for accreditation of hospitals. But one thing I learned in the years that I served on that board for accreditation, we were 4 of us every month accrediting almost like 500 to 600 hospitals. I mean, to me, we were giving out a stamp of quality, which meant just a logo. And we checked last year. I asked the CEO, have you done any studies to quantify the impact NABH accreditation has created on healthcare? He said no. I said, then what are we doing? And then me and Zaw started discussing that patient centricity is an overused word. If I ask anyone here or anywhere on a major forum, we won't get a definition of patient centricity. It's a very subjective word. Doesn't mean anything actually beyond just being used. So we both talked, and he comes from technology, I come from healthcare plus technology. We are both confused what to do with what we have. But the technology is a very interesting tool. We can convert a subjective idea into an objective indicator. And that's what exactly we have done through Patient Centricity Index. By next year, we should be able to rank a healthcare facility on a Patient Centricity Index on objective parameters. What that means is the way you deliver care will get redefined. And this is the world's first Patient Centricity Index.
Up next, we have a keynote address on the importance of digital health in ensuring equitable access to healthcare by Shri Bharat Lal, Secretary General, National Human Rights Commission. Let's listen to him.
When it comes to healthcare, as we all know, that digital technology, digital solution is the leapfrog factor. In a country like ours, which has got 650,000 villages and 18 lakh habitations, 4,300 plus urban centers, our cities, our towns, it is a digital health solution which is going to provide opportunity for each and every individual to have access to quality health care. In my opinion, the kind of digital solutions are emerging, the kind of experiments are going on throughout the country in different parts of various states. It means the whole menu of options are becoming available for whether it's for developed world or developing countries, global south, especially Africa, Asia, and other part, Latin America and other part of the world. You have to utilize this opportunity to come out with solutions. And when we talk about solution, patient centricity is going to be key. Regulations are going to be key. Cost going to be key, So democratization of the services which we are going to provide, I think that holds the key. And this technology or this solution, and few people not only can provide solution to India, but I think the whole world. And we must not miss this opportunity.
As the world transitioned to digital, with everything moving to the cloud, privacy and security have become crucial for our survival in this new landscape. Our next session will focus on the importance of building trust in digital health.
The concept that I'm going to share is based on digital identity. And digital identity, from my point of view, is the driver to implement, to achieve that patient centricity. Digital identity is the starting and the end point of patient centricity. The concept of digital identity that we implemented at the UN Joint Staff Pension Fund came from the need to address a fundamental question. Are the people that the UN Pension Fund pays on a monthly basis still alive? The solution was to create an application that, through the use of certain technology that have enabled us to implement a digital identity for proof of existence. The principle that I had to adhere to, the expectation, the benefit was in doing so, I had to ensure security, reliability, transparency, accountability, and attribution of the digital identity and the associated transaction deriving from that.
The internet is full of attacks, it's full of bad actors, and you have a lot of supply chain attacks, web attacks, all kind of attacks. So it's more into the technical terms, but there are organizations who are actually providing you a complete suite of security where we bring in the entire ecosystem in place to make sure that you are protected, your organizations are protected.
In the digital age, we cannot overlook a critical issue, that is, the challenges of adoption. In this session, a global panel addressed this topic from the perspectives of industry leaders, implementers, medical professionals, and the MedTech sector.
The topic is basically the future of healthcare in the digital world. As we all know that India's healthcare sector has been experiencing rapid growth, fueled by three factors: the vibrant digital landscape, the immense youth talent which is available to us, and a robust and effective and efficient healthcare ecosystem, including the startup ecosystem within the healthcare setup. We must acknowledge and admit that all stakeholders in the healthcare setup, whether they are healthcare providers, practitioners, policymakers, shapers, influencers, patients, caregivers, or their families, data or technology solution developers, builders, or providers. All of them have different challenges or barriers in terms of either designing, delivering, implementing, or adopting these solutions. The best way that we can solve for it is by empowering them through continuous support, training, and showing empathy towards their concerns so that we can foster increase in the overall digital literacy across all stakeholders.
Healthcare has always been delivered in person, and I think we have to remember that patients are used to going into the office. They have always thought to be touched and seen in person is how healthcare is delivered. And that's a barrier we're going to have to overcome culturally.
Up next, we have a session on integrated healthcare solutions and how they can lead to safer, better managed hospitals. Let's have a look.
ABAS, we have started from last year, the ABAS attendance. Now daily the monitoring of the faculty is taking place. We have Aadhaar-based attendance system in all medical colleges, and it is mandatory for them to put in the attendance. We have asked the medical colleges to have 25 CCTV cameras in important places of the medical college so that they can be monitored continuously. We don't need to send any team. We can get the back data also whenever we need to do it. There's an initiative by the National Medical Library, which is the largest medical library in the country. And we have started an ERMERD consortium through which we are distributing 250 medical journals to 57 medical colleges across the country free of charge.
Cloud9 is a group of hospitals we conceived 17 years ago because we believe that Cloud9 is all about pregnancy being wellness and not an illness, and pregnancy is a place where maternal deaths should not happen. That was the concept we built the hospital.
Moving on, the next session focuses on investing in women's health and discussed how well-being yields substantial economic and social benefits. Let's take a look.
A McKinsey report that came out within the last year said that narrowing the health gap of women would allow 3.9 billion women to live healthier and higher quality lives, and would result in at least $1 trillion, 1 trillion, that's TR, pumped into the economic productivity of the world.
Next up, we have a sessions on startups funding, where our speakers emphasize the importance of entrepreneurship in healthcare, especially in digital health and AI, and how startups hold the promise of creating the next big change.
You know, when I was in high school, this is precisely 40 years back, I wanted to become a doctor, but because I was good in math, I ended up becoming an engineer. So, and rest has been history, but it's always bothered me that, you know, I wanted to do things for healthcare, but Professor Gupta and I, we've been involved with US-India Endowment Board, where we actually created joint innovation between US and Indian government and so forth. And I sit here today and it makes me feel very special that we are talking about kind of entrepreneurship in the age of AI, but particularly in the world of digital health, because the healthcare sector is near and dear to me, something that I didn't pursue back then, but it's always been on my mind that, you know, this is where the real human needs come from, is when you can protect health, when you can preserve, when you can make people work. That's the real entrepreneurship. With billion people in India alone can benefit from the innovations that an entrepreneur can bring in.
The failure of a healthcare startup, digital healthcare startup, is more because of they're not estimating the working capital that gets stuck into it, and their penchant for growth, which leads to the organization finally getting into high interest kind of working capital, and finally it leads to a dead end wherein receivables are stuck and the organization goes bankrupt.
Welcome back. The pharmaceutical industry is rapidly evolving, and while discussing healthcare, we cannot overlook its significance. In this session, our guests will highlight the importance of integrating IT throughout the pharmaceutical value chain. Let's listen in.
The best part is that I watch and I have seen this growing year on year, not only in the number of attendees, but the best part is that when I go back and see the exhibition, I see a lot of things getting translated from what was being talked about during the initial days of Digital Health Summit when it started. I am very proud to be the head of INARE for this country, which is supplying medicines to more than 200 countries in the world, which supplies 25% of generics in the US, which supplies 40% of all the medicines in UK, which supplies 60% of vaccines of the world. And I will be waiting for the day when I have, or my successor will have, that opportunity to say that India is exporting digital health to more than 200 countries in the world and is actually having the highest share in the global business in digital health. And I also see and I'm confident that that day is not far away. In healthcare, the mindset of service is most important. And here also, if profitability is the driver, then we will never be able to reach to that last milestone, because there the profitability may not be as much as you get in the urban India. But if you have that mindset of service, then your driver always is thinking of serving poor, which will take you to the last mile, which we always talk about in the digital health.
One of the biggest changes that has happened to a patient's journey through digital health is the fact that there is a serious movement from being a passive observer to an active participant, and patient turned into consumer very fast.
Up next, we bring to you highlights from an engaging panel to explore the potential of AI in healthcare and how we can prepare for the age of generative AI.
What we need, not in Europe, globally, is a discipline for documenting these things so that the AI developer community can boost the confidence of its user environment. My tenet is at the moment, the AI demand-supply push-pull is a little imbalanced. There's a little too much push and not enough pull. We need to work together to make healthcare demand AI solutions and be confident about using them. And this kind of framework is what we need to adopt in order to help encourage that confidence and boost the pull in the market for AI.
What we are trying to do today is to ensure that your, you are actually working on all the 22 languages which are there in the Constitution, which can grow up to 100 as we go by, because India has about 100 languages. We are trying to do financial transactions with it. So that means we are trying to make the AI models 100% accurate so that the financial transactions can happen. Otherwise, the financial transactions cannot happen.
Coming up, in this session, our experts focused on utilizing digital technologies to empower individuals to take a more active role in managing their health and preventing disease. Let's catch up. Wellness and prevention in the age of digital health.
You all know that how our auxiliary nurse midwives working at the health and wellness centers in sub-centers, which is catering to a population of 5,000 in plain area and 3,000 in hilly and tribal area. So therefore, our one of the objectives is how best we can train them to work in the new the policy of the health and wellness centers. They are extraordinary. These community health officers are working in the rural area in the preventive and promotive, and also they are given the on-the-job training, especially in the digital health technology. And many of the nursing colleges in India of late are organizing the digital technology for updating the knowledge and skills so that they can work effectively.
So our mission is to advance health and empower people worldwide to live life to the fullest. So we are the company who provide home medical devices such as digital BP and also portable ECGs. And our vision is going for zero, which means that we want to reduce cardiovascular event and also respiratory event as much as we can through the digital solutions.
The topic wellness and the prevention is definitely very close to my heart, and over the last 2 decades we have been working with some of the biggest corporations of the India focused on improving the health of the corporate India, working with more than 300 plus corporations and servicing more than 1 million lives in India. Our objective is always to make the corporate India healthy, and we are seeing a lot of successes in the outcomes into that.
Moving on, our diverse panel of experts brainstormed the next level of partnership between the industry and the National Health Authority, exploring what additional steps we can take to enhance the Ayushman Bharat program's impact on the ground.
The Ayushman Bharat is I would call it a big baby step towards covering insurance. Ayushman Bharat, Craig, is a very interesting scheme government has come out, where the objective is to have a central repository of records. Right. A person who is residing in Mumbai goes to Delhi and falls sick or meets with an accident, as an Aadhaar card, the doctor treating there would have access to all the records. That is the very good objective.
Today, finding India-specific solutions is crucial but complex, and the effective use of digital technologies can help modernize and improve this complex system. To understand the importance of adoption of digital health, let's catch a special address by Dr. Vijay Chaudhary, scientist, member, Board of Governors, IIM Raipur.
Friends, it is very important in a country like India to find out India-specific solutions. we can have best practices from the world, but because of the unique nature of healthcare system where both private players and government plays equally important role, where both central government as well as state government plays equally important role, this complex healthcare system can be modernized and efficiently used using digital technologies. As we head back to our respective organizations and communities, let us just not talk about the digital health. It is important that we start adopting it because that is the future. As it has been said, that this is not an option. This is a given future to us, and it is best for us that we adopt it as soon as possible.
Next up, the Global Digital Health Innovation Awards celebrated and recognized exceptional accomplishments in advancing healthcare through technological strides and specifically emphasized innovation and its impact. The winners signify remarkable endeavors in propelling positive transformation and shaping the healthcare landscape through digital innovation. On the sidelines of the main event, exclusive spotlight sessions were organized. First up, we had a masterclass with global leaders where the audience had a chance to connect with industry titans who had shared valuable insights, discussed challenges and explored the future of the healthcare sector. Next up, the inaugural OHDSI Symposium in India focused on the transformative power of data-driven healthcare. The event explored the potential of real-world evidence and real-world data. A diverse group of stakeholders discussed India's current landscape in RWE/RWD, identifying growth opportunities and learning from global best practices.
We are very happy to have partnered with ODC. Why did we decide as Global Digital Health Summit to partner with ODC? I have been a firm believer that data is something that health is all about, and the way it is changing, healthcare will be driven by data and not the other way around.
The Odyssey India chapter, I'm very proud that we have the first session here and that we are able to bring the Odyssey also to India, have this chapter.
The reason that I'm motivated by this problem and motivated to collaborate with all of you is because all of us can share the fact that there is a journey that we'd like to be on, which is specifically how can we take healthcare data captured during routine care and deliver evidence to answer important questions that maybe matter to you directly or to a loved one or a friend or family somewhere around the world.
It doesn't take long now. I think it would be a matter of a few years to have a much more improved deployment of standardized EHRs. I think public trust is an uphill battle always. But what we have to do is to change the game from a bunch of promises to demonstrated realities.
Moving on, Digital Health Scientific Symposium brought together researchers and practitioners from around the globe to share about their research and evidence in support of digital health initiatives. Up next, Health Parliament, in collaboration with Brook India and Mission Rabies, a program of Worldwide Veterinary Service, hosted a spotlight session, One Health and the Role of Digital Technologies, to explore the transformative potential of digital technologies in addressing complex health challenges at the interconnected aspects of One Health. This session aimed to catalyze action and build a healthier future for all. Next up, in an exclusive closed-door meeting, participants from various courses offered by the Academy of Digital Health Sciences. This unique opportunity allowed for direct interaction with faculty and fellow students, fostering collaboration and knowledge sharing. At the end of this mega 2-day event and expo, Mevish P. Vaishnav, President, Digital Health Associates, addressed the gathering.
I would like to thank our founder, Dr. Rajen Pratap Gupta, the man whose vision has led to this global summit, where people from the entire continuum of care could come together, collaborate, and integrate technology into health. I would like to thank each one of you, without whom this summit would not have been successful. I would like to give a special thanks to our Ministry of Ayush, Ministry of Electronics and Information Technology, National Human Rights Commission, State Government of Maharashtra, and this summit would have never been possible without my team, the Digital Health Associates.
The two-day summit and expo fostered unprecedented collaboration among healthcare providers, MedTech and health tech companies, pharmaceutical leaders, policymakers and technology experts. The audience gained new insights, strategies and collaborations that promise to accelerate the adoption of digital health solutions worldwide. The Global Digital Health Summit 2024 has set the stage for an efficient, connected and patient-centric healthcare future. Thank you for watching this special coverage.